Hey, today's situation, mental health in communities of color. Who's there for our pain, the shame, the stigma, the hurt? I mean, who can we talk to? I think I have an idea. I know some people. Let's have that conversation right now.
Situations and conversations with Renee. Situations and conversations with Renee. Real situations, real conversations. Empowering the community leads to elevation. Entertainment and education, no better time than now. Pure enlightenment for the crowd. This is Situations and Conversations with Renee.
Welcome to Situations and Conversations. I am your host, Renee. So happy that you're joining me today, especially because we are here to talk about mental health, particularly in communities of color. And I am so happy to have PeaceHealth represented here today with April Allen, as well as Dr. Erica Torres. Welcome, you guys.
Thank you for having us.
Absolutely. I am really excited to have you guys here, because mental health is just such a hot button issue, especially lately.
Yes.
So before we get into the specifics, tell me a little bit, Dr. Torres, about PeaceHealth.
Yeah, thanks for asking that, because I think that many people may not know that PeaceHealth was founded by two women who were sisters. And they actually came to Washington, and they felt a need to support the communities, and more specifically oppressed communities, and specifically communities who were struggling financially, economically, and needed healthcare. And so they kind of stepped in and said, we're going to start a hospital. And they were considered Sisters of the Peace. That's what they were called.
Okay.
And they started PeaceHealth when there weren't all the regulations and all the, the requirements needed. They were two sisters who started a hospital. And they were founded with one of the core values of PeaceHealth that really was the foundation of PeaceHealth, that continues to be one of our core values, was social justice. And I think that's what pulls us to PeaceHealth, really draws us to PeaceHealth, is this core value of social justice.
I love that. Social justice with healthcare. Mm-hmm. When you say sisters, I grew up, I went to Catholic school, so I don't know if you're talking about sisters as in nuns, or you're talking about like biological sisters.
You know what? They were nuns.
Okay, I knew it.
But I want to say sisters.
Yeah.
Because they were down for the community. They were really, they were really down for the community. They really were, the way they talk about it is they were answering the call. Mm-hmm. They were answering the call from the community. And one of the focuses of PeaceHealth, foci?
What you all focus on.
Yeah, what we focus on. Let's go with that. Is going where you are called. Yeah. Not inserting yourself into a community, but going where you are called. Yeah. And so that's how PeaceHealth has situated itself around the Pacific Northwest, is only entering communities into which we have been called.
Oh, I love that.
And I feel like that's been our commitment as well around mental health.
I love that. Okay, now April, what do you do at PeaceHealth, and why did you join the organization?
I am the System Director of Diversity, Equity, and Inclusion. And so, I have a history with diversity, equity, inclusion.
For all those who don't know, April and I go way back, and we have done many an interview.
Yes.
On camera, off camera.
On camera, off camera.
And when I can say that you are about this life of equity and diversity, inclusion, social justice, and going where you are called, I know for a fact that you embody those things. And so this organization was a perfect fit for you.
It was. And so going off of what Dr. Torres says, or my friend Erica, as I like to say, I was attracted to it because of its values of social justice and respect. And DEI, I always say the core value has to be respect for you to do it well. If you don't have respect, you can't do DEI. It's all fluff and stuff, as I call it. So I said, you know what, this is a really good opportunity to propel an organization forward in this space. They have all the values in place that are needed. And so I was willing to put my hat in the ring and do some work there.
And I'm glad, because that's how come you guys are here today, because of the relationship and the respect
that
not only do I have for you, but whatever organization you connect yourself with, I know that they have to be about that. So, Dr. Torres, you talked about mental health. That's your role at PeaceHealth, correct?
That is. I'm the Assistant Director of Behavioral Health Services at PeaceHealth.
Okay, and thank you for doing that, by the way. That's a fantastic role.
She said a lot.
She said a lot. She did.
Long title.
Whatever she said.
Yeah, like, it sounded amazing. It sounded really good. But when we talk about mental health in communities of color, I want to ask you, what do you see is the biggest need?
That's a really big question.
I want to go dun, dun, dun.
I know, right? Take your time.
I think it's a big question because I think that there is what our communities. I'm Latina. I come from a community of color, and I think that there are so many things that impact us just within our family cultures, and then within our overall culture. But then I think that there is oppression and systematic and institutionalized racism that adds on to the struggle. And so I think specifically for Black, Indigenous people of color, the struggle is not just an internal struggle, even though we might feel like it's just an internal struggle. It's the internal struggle exacerbated by the social injustices that are impacting us.
Right, the external factors that we have to deal with every day.
Every day.
And I mean, when
Every
people,
day.
I need y'all to understand every day. It's not like it ever goes away. Not in this country, not the way it has been systematically woven into the fabric of America. It's so ingrained that like you almost start to feel insane when you are waking up
right.
and
Yes.
realizing that you've been pushed down your whole life.
Yeah. Yep.
You know what fascinates me about this is that it's not just that. It's that it's now been ingrained. No, that's probably not the right word. It's been imposed on our own cultures, where even seeking help can be perceived as self-indulgent. I think about Audre Lorde's quote that says, self-care is not self-indulgent. It's self-preservation.
Amen.
Yes.
Oh my gosh, that's a good
Good
one.
one.
Self-preservation.
Yep.
Okay, we're gonna hold right there.
Yes.
Because we have to come back. Got to take a quick break. A word from our sponsor. Don't go away. We're coming back with PeaceHealth, Dr. Torres, April Allen. Don't go away. We'll be right back.
We all deserve the opportunity to reach our full potential. Since 1981, Self-Enhancement Incorporated has been a one-stop resource for youth and families in the Portland metro area. For over 40 years, SEI has helped more than 16,000 students and families each year. SEI needs your help. Visit selfenhancement.org/donate. Your gift will change someone's life. Visit selfenhancement.org/donate to learn more.
And we are back with Situations and Conversations. PeaceHealth is represented today by April Allen and Dr. Erica Torres. And we left off talking about how mental health is really self-preservation. Instead of what a lot of communities of color seem is self-interest, and like a negative connotation, right? Like this indulgence.
Self-indulgence.
Yeah. Now, why do you think that is? I mean, what's behind that mentality in communities of color?
I think you know, Trey. I think you're being nice to the camera.
Well, let's have this conversation for
let's
the
have
people,
the conversation. Right? Yeah, I mean, there's multiple factors, right? We can look at, especially African Americans or people of color tend to be people of faith or have higher numbers that are people of faith, and a lot of times we are told that if we have enough faith, that
pray your way through.
Pray your way through.
Yeah.
Pray your way through. That is a common theme I still hear from I love you, Mom, but from my own mom.
Right.
It's like,
Right.
"Why are you praying?" And I'm like, I'm about to go crazy. So I need it's okay to get help, but a lot of that has impeded our progress in my mind in that area. Also, I think we have this superhuman persona in the African American community, right? We always hear the term Black girl magic.
Yes.
I
like my T-shirt though.
I'm not trying to take
I
your
do like my
t-shirt.
Black Girl
I'm
Magic
not-
T-shirt,
I'm
but
not-
I do know where you're going with this.
Yes.
It's almost as if it's like Why do we have to be magical?
Yes. And the thing is, and I hear so many women, I'm all for the t-shirts and the mugs, and I've had them too, but I actually had stopped saying it. That's not to shame anyone else for saying it, because there is something magical. However, I do not want to give the impression that I'm not human, that I don't bleed, that I don't need help, I don't need support, that I can do it all. I cannot do it all. And if I try to do it all, at some point, something's going to drop or I'm going to drop.
Right.
And so and we've had those conversations.
Absolutely.
I remember we've had these conversations.
We've had some
tears
on TV.
Yes.
Being very vulnerable
Yes.
about how real that is. Because
is.
we, that strong Black woman all the time, it's like, I can't live up to that.
No.
Yes, I am strong. I'm not taking anything away from myself.
Yes.
But that doesn't mean that I don't feel.
It doesn't mean you're not fragile too.
Man, I break.
Yeah.
Believe me.
Yeah, two things can be true at the same time.
Right, right.
So, I think those are two major reasons. There's a stigma, right? I look at it, there's African Americans, Blacks make up about 13.4% of the population, and they say about 16.9, so almost 17% have mental health challenges. And so I just think it's interesting that even with those numbers that we still have this barrier mentally.
Yeah, it is.
So
we have even more to overcome
Yes.
when it comes to seeking mental health.
Yes.
So this is good, because this pandemic has also made it even worse.
Oh, okay. Let the church say amen, whoever's on here. Amen.
Amen.
Amen. Because all I know is I thought it was Black Girl Magic until to COVID hit. And I said, COVID, I call her Corona, and I say, she's not my friend.
No.
And so I know as a mother, as a working mother, plus dealing with COVID, plus looking at media and seeing the racial injustice and the killings of people that look like me,
Consistently.
Yeah. And it was just too much. It's still too much. And so I also had to engage in conversations with my children, now 6 and 9, that I wasn't prepared to have, right? And so you're telling them about conversations you're hoping to have a little bit further down the line, as they're walking in with TV shows going, and you're trying to change the channel, but you're also trying to understand what is happening in the criminal justice system, what's fair, what's just, and so it's a lot. It's a lot. And so it's been 2 pandemics. And like I said, you go to work even. And I remember being in a situation, not at PeaceHealth, but at another situation, another job. And people were so flippant about COVID. So flippant. Like, I'm sick of this. I just want I don't understand what's happening.
I just want my life back.
Yeah, I want my life back.
We all do.
And I'm like, okay, but then when you look at the statistics and you see 1 in 3 Black people know someone who died, actually died from COVID, me included. I've known 3 Black people who have died that have been part of my life from COVID. And you are so flippant about it. You're dealing with that stress. And then think about when you turn on the news and they're talking about, well, people are dying from COVID in higher numbers in Black and brown communities. That's stressful, because you're trying to figure out why.
Yeah.
So
now you're looking at you, you're looking at your kids. It's a lot to consider.
Yes, it's a lot.
And so mental health for people in general, but particularly communities of color, is so important.
Yes.
So Dr. Torres, come and jump back into this conversation. As a mental health practitioner at PeaceHealth, what are you guys doing to try and eliminate or at least knock down some of these barriers, be they mental barriers, cultural barriers, whatever they are, to get people to know that you guys are there and you're ready to help?
Yeah. Well, first and foremost, I think that we are being really intentional about bringing on practitioners who are going to provide culturally responsive care. Like, the last thing I would want is to have a Black or brown person finally get through the stigma, get through the challenges, and then walk through the door and then be hit with the worst therapist. Be hit with a therapist that is not able to understand their cultural, who they are. Who they are culturally.
It's important.
And what they're grappling with. It just if you walk into the door, I want you to see somebody who's going to get it.
Yes.
It's not going to be help me understand why that's hard for you as a Black woman.
And
next thing you know, you're doing the educating in the session.
And you're back to educating, and I won't cut you off there, but that definitely for me, I have no problem saying I went and got a therapist. And, we talk like girlfriends. And I was like, they need to be African American. Because I was like, I need you to understand what I am going through right now. And this is not a teaching session. Right? I'm a professor, but I won't be teaching a moment
I understand.
for you. Like, I need them to be like, I got the nuance of what's happening here.
Wholeheartedly understand. Now, that being said, there are few practitioners of color in our area.
There are.
There are a few. And I feel guilty because I was one of them. And then I left my private practice to pursue this other avenue and trying to help folks. And so many times I do hear, even from, community members, well, I finally got over the stigma. I'm trying to make calls. I can't find anybody. And if I do, they're booked up.
Yeah.
How can you guys help?
Yeah. So I'm newer to the Pacific Northwest. I came from the San Francisco Bay Area.
Yeah, me too. I know you had that. I saw your cell phone number and I didn't want to say nothing, but we're kin like that. We're kinfolk. Okay.
And so in coming and being asked to grow behavioral health services, I knew that I could only do it if I did it with all my heart. And to do it with all my heart meant be doing culturally responsive, trauma-informed care. And so what that has meant is recruiting people who are people of color, who have been doing this work in our communities. And we recently opened an outpatient clinic in Vancouver, Washington called PeaceHealth Cascade Park. The managing psychologist.
That's great.
The managing psychologist is a Black and Latina woman, and by the name of Dr. Camille Moreno. And
She's here, by the way. She just couldn't be on camera, but shout out to Dr. Moreno. We see you. We see you. And we did a lot to make that space very intentional. You walk into the space and you feel welcomed as a person of color. All the art in the space represents people of color. Right. Decor is also important.
And I think not just people of color, but different families being represented. You walk down the hall and you see a child with two moms, a child with two dads, a child with a biracial family, a child that's being raised by their grandparents. So there's a way in which we're working really, really hard to be intentional about being welcoming and being thoughtful about bringing in our communities.
Well, I got to tell you, we appreciate that right off the top. Before we even step in the doors, the fact that you guys are so intentional about making sure that communities of color are welcome and they feel warm and embraced, because it's not easy, mental health work, doing it or seeking it. And so the fact that the two, can come together in harmony at PeaceHealth with you guys at the helm, I feel safe in telling everybody, drop that website on the screen and make sure that you guys definitely get out and connect with the folks at PeaceHealth. You can obviously see that they care deeply. And so that's so important. Thank you guys so much.
Thank you for having us.
And I'm not so sure I want to let you all the way go yet. I'd like for you to stick around for something special. Can you do that?
Yeah.
Absolutely. Yes. Okay, great. I want you to stick around too. Don't go away. We'll be right back with Hey Trey. Hang tight.
Self-Enhancement Inc. is the blueprint. Black founded, Black owned, Black led since 1981. What does Self-Enhancement Inc. do? Whatever it takes. We support Black students 24/7, from elementary to college and beyond. We believe that every student is created with purpose and talent specific to their unique identity. It is our collective responsibility to ensure all children have equal opportunities to thrive. If there is no food in the house, we buy groceries. If there is no family cheering section, we show up. If there's no transportation, we get them there. 98% high school graduation. More than $500,000 in scholarships awarded annually. Help us build culturally appropriate solutions by committing to contribute $10 a month right now. We need us everywhere. Invest in the blueprint today at selfenhancement.org/blueprint.
All right, welcome back to Situations and Conversations. It is now time for a segment we call Hey Trey. That's where you get to ask me a question, so go for it.
And we're here on site at one of our community locations. Hey, I'm Asa Spade.
I'm Javen Harper. Hey, Trey, we have another community member that has a question for you.
Take a look.
Hey, I was wondering, what do you think about non-Black people watching Black entertainment and Black trauma movies? And how do you think it affects Black people in their experience as a whole?
That's a good question. I'll take it from a non-clinician perspective. I tend to think of it as a lot of times I'll say this graciously, but white folks look at it as a spectator sport. It's kind of like, wow, this, this is happening. And is this really happening? And I say this because 75% of white people, I think that's the last poll that I saw, they do not have any close friends of color or black friends. So this is their exposure a lot of times to what they would see as the black experience, whether right or wrong. And so I tend to think it complicates things because a lot of times in what I do in the workspace, people come in and then they say ignorant things, and what we would call microaggressions happen. So they're saying things that are insulting or offensive, and they tend to think it's not and say, I had no clue, because they've been watching this cinema. So that's just my take on it. I think, watching it, you have to be careful because sometimes it can open up a wound or re-trauma, but I definitely watch those movies because I feel like I'm not alone and I'm seeing an experience and I'm relating to it.
Yeah, and I think I love that. And I think what I would add around from a clinical standpoint, the impact of those microaggressions and how they get in and how they then either become internalized. You start believing something about yourself that someone is imposing onto you, or you're just feeling the pain of feeling like, those microaggressions feel like macroaggressions. Yes. They feel like macro assaults.
They call them 1,000 cuts.
That's right.
Yeah.
That's right. And so I think that there is a potential for really harmful impacts on the Black experience by dominant culture.
Mm-hmm. Yeah, I like that. Glad you guys were here to answer that question. That's a good one. But I agree with you. I think that you have to be careful what you put into your spirit.
Yep.
And so if you're constantly watching trash, guess what? You're going to be feeling and exhibiting trash.
Yep.
And if you constantly feed your spirit with trauma, and traumatizing images, well, same thing happens. So you just want to be careful. I mean, some of it's like a grain of salt kind of thing. And maybe some education on the back end. Some conversations are always good.
Yes.
Always good. All right. Ooh, those are good ones.
Answered it anyway.
I know. I can't help it. I have to weigh in. Blah, blah, blah. All right. Thank you, guys. Thank you. We'll be right back with Artist Spotlight in just a bit.
Urban League of Portland presents COVID Conversations.
Black folks and COVID-19. We know that Black folks and brown folks have been greatly impacted more than Caucasians with COVID-19 here in Portland and in the rest of the country. But there have been contributions that have been made by Black folks in terms of making sure that we're all protected. Dr. Kizmakia Corbett led the Moderna team in creating the COVID-19 vaccine. On the Pfizer side, you have Dr. Tatenda Chopera, African-American male, who also led his team in creating the COVID-19 vaccine. What I want to highlight is that back in April of 2021, Black folks were being hospitalized at about 5.5 times, 6 times the rate of Caucasians in the Portland metro. And what has transpired the last few months with the efforts led by many different folks in the public health sphere is that we now have Black folks being vaccinated at about 86-87%. So that means there are now more Black folks vaccinated than not. And that's a huge improvement.
COVID Conversations are brought to you by Urban League of Portland, empowering Black communities in Portland and Southwest Washington since 1945. For more information, head to ulpdx.org.
Press release marketing is the solution for small business owners wearing way too many hats. We suggest you talk to a professional today about outsourcing your marketing campaigns and strategies. To book a complimentary consult, visit justpressrelease.com today.
The Urban League of Portland strives to provide services to uplift our community. During the pandemic, we have worked tirelessly to provide COVID testing and vaccination clinics to those in need, as well as keeping up with our elders to make sure that they have the resources available to keep from being socially isolated. We continue in our mission to empower African Americans and others to achieve equality in education, employment, health, economic security, and quality of life. Together, we can overcome COVID-19.
Welcome back to Situations and Conversations. Now it is time for Artist Spotlight. My guys, Asa and Javen of P-Town Media are out in the community with a local artist. All right, you guys, who's in the spotlight?
Thanks, Trey. And we're here with another amazing segment of the Artist Spotlight segment right here at DB Nation Studios. Hey, I'm Asa Spade.
I'm Javen Harper. We are P-Town Media. This week's artist is amazing with his gritty lyrics, jaw-punching jabs. You really got to take a listen to him. And this is DB Nation's own Swanson. Help me welcome Swanson.
Take a look.
It's Mr. Dr. I with an I guy. There's no up my vibe. Only words I abide by for mine, for my tribe. Knowing what I'm like, been living a high life, been grip like a knife tight. Knowing how I might, boy, I spit like a drain pipe, and it's fucking insane, right? I've been keeping my aim tight while you're hiding in plain sight. I'm kinda ain't nice, and I kinda ain't right. If my timing ain't right, I died and came twice. R.I.P. to your top 5, showing up like Jesus in some new Adidas slides, a fanny pack full of drugs, and a couple of rules to live by. Never with bitches and Uggs, no, not this time. You know me though, I'm paying no mind to all these backward white actor type rappers that all talk that talk and then run the cops after, saying you'll never snitch, but I wouldn't put it past you. You lucky it's such a supportive scene, propping up that confidence that you don't have when you speak to me. So how about you just Penwell on the beat, motherfucker. It's Mr. Dr. I with an I guy. There's up my vibe, only words I abide by for mine, for my tribe. Knowing what I'm like, been living a high life, been grip like a knife tight. Knowing how I might, boy, I spit like a drain pipe, and it's fucking insane, right? I've been keeping my aim tight while you're hiding in plain sight. I'm kinda ain't nice, and I kinda ain't right. If my timing ain't right, I died and came twice. A whole lot of y'all wanna rap like me, dropping dead with what you said above the head like me. Walk in a room here, beat, and then just eat like me. Got a rapper checking himself just like some new Nikes.
Swanson, amazing performance. We appreciate you blessing us with your artistry. I got a question for you. Where did you pick up your lyrical style?
Just along the way with everything that I listen to and everything that I've been around, and just trying to be unique and be myself.
Right on, right on.
Amazing performance as well. Man, I didn't really expect that. Great. A question. What is your relationship with the studio here? I see that you're a sound engineer outside of the music. Talk a little bit more about that.
So basically, DB Nation and PDX, I'm an engineer right now. I work with the great Sean Gillies, Noah Penwell, who also actually produced Sucker Punch, and Aviel, the man himself, Timmy Tukis, and Max 91. So we have a great team here, and yeah, been putting in the work for a long time.
Well, there you see it. Swag's all in the community. Another dope performance on the Artist Spotlight segment. Hey, back to you, Trey.
That's what I'm talking about. Appreciate you for that performance. Also want to thank our guests from PeaceHealth, April Allen and Dr. Erica Torres. Remember, mental health in communities of color, that's their specialty, so reach out to the folks at PeaceHealth. And then, of course, I want to thank you guys for hanging out with us today. I love and appreciate you for that. We will be back again next week. Until then, make sure you take excellent care of yourselves as well as other people. When you think me, think we, and when you think you, think too. See ya.
Special thanks to our presenting sponsor, Self-Enhancement Inc., Youth Potential Realized. And thanks to our friends at PeaceHealth, Urban League of Portland, Holla, and Home Place Furniture and Design. Situations and Conversations with Trey Renee is a Bum Juice Entertainment production in conjunction with Thomas Chung Films, P-Town Media, Press Release Marketing, Robin Allen Style, and Hype Her Ventures. Situations and Conversations with Trey Renee, Saturdays at 10 a.m. on Fox 12+.